You know that ringing sound you sometimes get in your ears after a really loud concert? Well, imagine if that sound just never went away. For millions of people, it doesn't. It's called tinnitus, and today we're going to dive deep into what causes this phantom noise and, more importantly, what we can actually do about it.
And for so many people, this experience is so much more than just a little ringing in the ears. This quote really says it all. We're talking about sleepless nights, real trouble concentrating. It can strain relationships. It's this constant, relentless background noise that honestly can threaten to just overwhelm your daily life.
So what is this condition officially? Well, tinnitus is basically the conscious awareness of a sound, that ringing or maybe a buzzing or a humming, when there's absolutely no external sound source causing it. It's a phantom noise generated inside your own head.
And if you're sitting there thinking, hey, that's happened to me, well, you are definitely not alone. It's an incredibly common condition. We're talking about 15% of people being affected by it on a regular basis. And get this, up to 2/3 of all adults will probably experience it at some point in their lives. It's really common. All right, so let's get into the big question. What actually causes the noise? Where is this persistent sound really coming from? Let's explore the origins.
Okay, so what's really fascinating is that tinnitus isn't just one thing. It's broken down into two main types. The first, and by far the most common, is subjectivous tinnitus. That's a sound that only you can hear. It's your own personal soundtrack, if you will, and it's often linked to some form of hearing loss. Then there's this other, much rarer type called objective tinnitus, and this is wild. This is where a sound, like a pulse, can actually be heard by a doctor or an examiner. It's an actual physical sound happening inside your body.
And the list of potential triggers is, well, it's pretty long. Almost anything that messes with our auditory pathway can result in tinnitus. The big ones, of course, are hearing loss, either from getting older or from exposure to loud noise. But it can be other things too. Something as simple as too much earwax, certain medications like high-dose aspirin, head and neck injuries, even stress and anxiety can be a trigger.
And this slide illustrates one of the leading theories, and it's a real mind-bender. Tinnitus isn't just an ear problem. It's a brain problem. See, when hearing loss happens, the brain suddenly isn't getting the sound signals it's used to. So what does it do? It might just turn up the gain, kind of like turning up the volume on a stereo to hear a faint station. It's trying to listen for a sound that isn't there. And in doing so, it actually creates the perception of sound. It's the brain's response to silence.
Okay, so let's say you go to a doctor about this. What can you expect? How do they even start their detective work to find the source? Well, believe it or not, it really just starts with the conversation. A good doctor is going to take a really directed history to understand the unique character of your tinnitus. They need to know everything about this sound you're hearing.
For instance, they'll ask, is the sound constant or is it pulsatile? Does it seem to beat in time with your heart? That's a huge clue because a pulse-like sound might point to something vascular, related to your blood vessels, and that's something they'll definitely want to look into. Then they'll want to know, is the tinnitus in one ear or both? Now, having it in both ears is actually more common, but if you're only hearing it in one ear, that's called unilateral tinnitus, that can be a bit of a red flag for a more specific, localized issue that needs a closer look. And then, maybe the most important question of all, how much does it bother you? I mean, really bother you? Because your answer to this single question is what's going to guide the entire management plan. It's not just about the sound, it's about its impact on your life.
So when doctors put all these clues together, certain things really stand out as red flags that need a deeper look. We're talking about that tinnitus in just one ear, the kind that pulses with your heartbeat, any asymmetrical hearing loss, or if it comes on suddenly with vertigo. Any of those mean it's time for more investigation, maybe even an MRI or a CT scan, just to be safe.
Okay, so once the detective work is done and any serious red flags are ruled out, the whole focus shifts. It's less about finding a single cause and more about managing the sound. So let's talk about what that looks like. How do we shift from cure to control?
Okay, this is a really crucial point to understand. The goal here is management, not necessarily a cure. For most people, there isn't a magic pill that makes the sound go away forever. But, and this is a huge but, that absolutely does not mean there's no hope. Far from it. The goal is to get to a point where the sound is so well managed that it's no longer a big deal.
So what's in the tinnitus toolbox? Well, there are three main evidence-based strategies. First up, hearing aids. If you have hearing loss, these are a game changer.
They amplify all the external sounds around you, which basically gives your brain more to listen to, and that can make the tinnitus way less noticeable. Then there's sound therapy. This is all about using other, more pleasant external noises to either mask or distract you from the tinnitus. And finally, there's cognitive behavioral therapy, or CBT. This is amazing. It's a way to retrain your brain and change how you think about and react to the tinnitus, which helps reduce the distress it causes.
And this is where things get really exciting. We're now at the new frontiers of treatment with things like bimodal neuromodulation. It sounds complicated, but the idea is brilliant. It's an emerging therapy that combines sound, which you hear, with some kind of gentle electrical stimulation, for example on your tongue. The idea is to hit the brain with two different signals at once to help retrain its response to the tinnitus. It's pretty cool stuff.
This all brings us to the most important part, really, the path to relief. Let's look at what this journey looks like and how you can take back control from the noise.
So here's a simplified look at the management pathway. Step 1. Identify the type and cause. You got to rule out any underlying medical stuff first. Step 2 is all about assessing the impact. You have to answer that big question. Is this tinnitus actually bothering you and affecting your life? And that leads to step 3, choosing a strategy. You know, for some people whose tinnitus isn't bothersome, just getting reassurance that it's nothing serious is enough. But for those who are really struggling, that's the signal to jump into active therapy.
And the ultimate goal of all of this has a name. It's called habituation. This is such a powerful concept. It doesn't mean the sound vanishes completely. It means you get to a state where you are no longer bothered by the noise you hear. Your brain basically learns to file it away as unimportant background noise, kind of like the hum of a refrigerator. You know it's there if you listen for it, but most of the time, you don't even notice. It's how you can truly reclaim your peace.
So that leaves us with a final, pretty profound thought. If tinnitus is really the brain's response to a loss of sound, what happens when we learn to listen differently? What if the path to relief isn't just about turning down an unwanted noise, but about fundamentally changing our perception and our relationship with the very act of hearing itself?